My name is Rick Thirlby. I'm a general surgeon who specializes in gastrointestinal surgery. My clinical focus is colorectal cancer. The main reason that patients should receive their care at Virginia Mason is that we have demonstrated improved survival. For patients with advanced rectal cancer, which is so-called stage 3 tumors, we have a 10 to 15% improved survival above national norms. Patients with metastatic rectal cancer, our survival rates are double the national norms. There are many reasons why the survival rates are improved at Virginia Mason. Colorectal cancer patients frequently need to see a surgeon, they need to see a medical oncologist, a radiation oncologist, gastroenterologist, pathologist, radiologist, genetic counselors, and we're able to provide that multidisciplinary care in a seamless fashion. The patients have very short waiting times, and occasionally frequently we get all of these consultations accomplished in one day. Our first job is education. Many of them have significant fears and lack of understanding about the effect of colon cancer on their bodily functions, and there's fear about the possibility of a colostomy. So our first job is to really educate the patients. It's important to point out that the colon and the rectum are really the same organ. The treatments are significantly different, however. Patients with rectal cancer frequently require radiation, and they occasionally need colostomies. Patients with colon cancer never need radiation, and they infrequently require colostomies. Although our primary objective in treating patients with rectal cancer at Virginia Mason is improved survival, we think we do a spectacular job in what's called sphincter preservation, which is the avoiding a permanent colostomy.
My name is Bruce Lin. I'm a medical oncologist who specializes in gastrointestinal cancers. I have a special interest in colorectal cancer. As Dr. Thirlby mentioned, the treatment of colorectal cancer often involves multiple specialties, including radiation oncology, gastroenterology, general surgery, medical oncology, pathology, radiology, and genetic counseling. It's often the medical oncologist's role to help patients navigate through a different specialty and to integrate all the treatment recommendation together for patients and to help them understand the prognosis, diagnosis, and different treatment options for colorectal cancer. And I'm often participate in these multidisciplinary tumor boards to advocate for my patient to come up with the best treatment recommendation for each patient. And I believe because of Virginia Mason's uniqueness in having all these different specialists under one roof, it's often a very convenient place to offer a patient the best care available.
Our clinic and hospital staff are terrific. At first postoperative visits, our patients routinely thank us for the compassion that they receive from all members of the healthcare team, and they routinely say that if they have to come back to a hospital, they or their family will come to Virginia Mason.